Welcome back to Go Ask a Nurse, the podcast where healthcare professionals share their stories, experiences, and insights from the front lines and beyond. I'm your host, Anna Marie, and today I'm so excited to be joined by Dr. Stefanie Leyden, a highly accomplished nurse practitioner whose journey through emergency care, forensics, hospice, and advanced practice nursing is truly inspiring. She's been born and raised here in Lincoln, Nebraska. She earned her BSN from Union College and went on to build a career spanning the ER, ICU, hospice, and education. Along the way, she became a certified sexual assault examiner, completed 2 master's degrees, and earned her Doctorate of Nursing Practice. Today, she specializes in pain management, psychiatric mental health, aesthetics, autoimmune disorders, and hormonal therapy, all while teaching and mentoring the next generation of nurses. In this episode, Stefanie shares her remarkable career journey, her passion for patient-centered care, and how she continues to grow and serve and inspire, both in her practice and in her life as a mom, wife, and now a foster parent. So let's dive in. Well, welcome, Stefanie. Thank you so much for being on Go Ask a Nurse.
Thank you for having me.
So tell me a little bit about what you're doing now with your business.
Well, I am a family nurse practitioner. I was born and raised in Lincoln, spent some time living in Omaha, have worked in Omaha, but most of my nursing career has been in Lincoln. And so I'm very passionate about, giving back to the community that I was raised in, and particularly women's health. I don't necessarily claim that that's a specialty, but it seems that I see a lot of women that are experiencing perimenopause symptoms, or maybe just not getting answers and don't realize that it's something that's pretty explainable, that there isn't something wrong with them. And so helping people figure that out and just give them some confidence and help navigate a time in their life where things are changing and they don't maybe feel like themselves is really rewarding.
I mean, you really dive into everything that they're taking, all their medications, like what are their goals, lab works. I mean, you offer so much to kind of get to the root cause of what's really causing their problems.
Yeah. I do think that it's complicated. There's so many different aspects to what makes us us, and that's everything from our hobbies and the things that we like to do with our free time, or if somebody lives close to family or they don't live close to family. So many of the stories that I hear are things like, I don't get to see my grandkids that often, but when I do, I want to be able to keep up with them. I want to take them to the Omaha Zoo. I want to be able to, walk 5 miles and then not be laid up for a week after that. And so, when I tell you that I really do hear it all, there is a large spectrum of people from, young women that have young families where I'm seeing their children, all the way to postmenopausal women that are trying to navigate living with osteoarthritis, but they want to, be active with their grandchildren. And I don't think that that's just a simple thing. I think it's something that you really do have to spend a lot of time getting to know that person and what their goals are, what motivates why they're coming in the first place. And a lot of that helps me determine how simple or complicated of a plan of care they're going to be able to adhere to. And I think that that's really important too. It has to be sustainable and maintainable.
Do you find that most of your patients come in willing to abide by like what you're asking them to do? Because I see so many patients, maybe I did, because there's that generation out there, the boomer generation,
Yeah.
there's a pill for everything, or they'll take it if they want to, or you tell them to go exercise, try to get up and move, and their movement is like walking from the bedroom to the bathroom.
Yeah. Yeah. What I have found in general is that once people make it to me, they've kind of been through the ringer already in the traditional medical system, and they are frustrated and sometimes exasperated to the point that I hear this a lot, I'm willing to do anything. Um, and I don't think that I necessarily ask that they do things that are really complicated. But being able to figure out what is maintainable and sustainable for that person can be a little complicated because there's so many layers. Um, so I still try to make sure that when I'm making decisions about what I'm going to ask somebody to do, that I feel like I'm going to get that compliance, or if I feel like that's something that probably is not going to be, a long-term sustainable thing for somebody, then figuring out what a workaround or a modification that is sustainable could be. So trying to meet them where they're at and get as much compliance as possible, even if that doesn't look like what optimal plan of care type involvement would be.
So, with your business, you dive into various areas, the medical part and then the aesthetic part.
Mm-hmm.
Can you walk us through what some of the aesthetic things that you do at your practice?
Sure. Um, so I started as a new nurse practitioner in the chronic pain management setting, and it was not my dream job by any means. It was what I needed to do at the time. But I am so thankful for that job and that experience and what I learned from the physician who hired me. I ended up with a lot of injection experience. I ended up with somebody who was very supportive and open-minded about looking at people as a whole. For example, people that are on chronic opioids can have a lot of hormone disruption, particularly men. Opioids can lower their testosterone. And it can also, because of being in chronic pain, cause anxiety and depression that maybe wasn't there before, but that becomes an issue as a result of feeling hopeless. And he was very adamant that each of us that were part of the team and seeing patients looked at all of that globally. If he said it's your duty that if you're giving somebody a medication that you know is either going to cause a hormone disruption or potentially cause them to struggle more with their mental health, it's your duty to do something about that. So we were doing hormone replacement and we were doing a lot of psychiatric care within chronic pain management. And I didn't expect that. As far as the cookie cutter, I guess if you want to say like view that I had of what chronic pain management was, it was eye-opening to actually get in and start getting my hands dirty and come to find out I was working for somebody who was really pretty holistic and very smart and really cared about his patients. And it helped foster my ability to get experience at looking at people the same way and being able to incorporate some of those things. So while aesthetics doesn't probably seem like it might fit, I have a lot of injection experience that makes me a good aesthetic injector. It also bridged regenerative therapies that we were using as joint injections into aesthetics because a lot of those same products are used in the face. So, for example, hyaluronic acid is your standard facial fillers. It's also the Gelson and Synvisc name brand knee injections that we use for osteoarthritic pain. And so being able to work with those products in two different applications, again, gave me a lot of experience that sort of bridged the gap and made it make sense for me to offer all of those things together. So I do Botox, I do filler, and then I have a non-invasive ultrasound delivered radio frequency machine that lifts and tightens the skin through stimulating your own collagen and elastin production.
So when you're talking about like hormonal disruptives, and when we think about it, we are seeing so many more mental health issues, more and more now, and even in younger people. I can't say that they're on a lot of different kind of medications. I know a lot of these teenagers are starting on birth control, and we know what that does, being on that over time. But also, like, you think about all the energy drinks, all the things that they're putting in their bodies that are just really disrupting their hormones. How do you deal with that?
Yeah, that's tough. I mean, I love a good scented candle as much as anybody else, but artificial scents, artificial flavors, artificial dyes, it is our environment. We can't get away from it completely, but I think having the knowledge of what those things can potentially do allows us some empowerment to make decisions about it, right? So, I try to get cleaner alternatives that might look like the water flavor drops for my kids that don't have synthetic dyes. Aldi actually carries a brand that says it's ADHD and autism approved. And I believe that product comes out of Canada. Don't quote me, but I do know that is a place where I have gotten those synthetic, especially some of the problematic ones, like some of the red dye. I have gotten those products at Aldi. And educating my kids, they love scented lotion and they love candles and excuse me, they love energy drinks. But helping to educate them and my patients on how to read labels, what to look for, what things are kind of a hard pass, and what things are not great for you, but probably tolerable in moderation. Doing things on somewhat of a quarterly basis to help detoxify, support the liver. I love glutathione. I love, there's a supplement called SAM-E, so SAM with a lowercase e. It supports liver detoxification. It supports mental health. It's a mood stabilizer and natural SSRI. But it's particularly beneficial for, all of the methylation processes in the body. And with certain gene mutations, we've got people that don't methylate as effectively and they end up accumulating more inflammation. And that can maybe be why, one person can tolerate a lot of artificial fragrances, synthetic dyes, and their neighbor is extremely inflamed, having a lot of autoimmune type symptoms, and just feeling very, very miserable when, maybe the environments are mostly comparable. But, there's a lot to be said about some of those, genetic variants that allow some people to detoxify better than others. So I think arming yourself with knowledge helps you make as good of decisions as you possibly can, even if sometimes that still means like, yes, I have the energy drink, or yes, I know that there's red dye in licorice, but a couple pieces are probably okay every once in a while.
Make it a treat.
Yep, that's right.
But I'm not going to mention any names of businesses, of organizations, but there are companies that I have banned my kids from using their lotions, their body scents, and their scented candles. I'm really particular about what they do put on their body. And I know I'm like that psycho mom because we know, being in healthcare, and your skin is your largest organ and it takes it in. So I try to be really careful what they buy. I don't want to be crazy and not let them live life.
Yeah.
But also we know what's in the products. And so why put them at risk for anything if I know what's in there?
Absolutely. Yeah, I agree, especially because I was able to see a clear difference in my daughter's ability to concentrate when she had red dye versus not. So when you get to see that, it isn't just a theory or it isn't something that somebody suggested on social media that really doesn't have any weight. I've seen it make a difference. In her ability to sit and focus, or how hyperactive she behaves if she's had it. And, when you can tell, it becomes less and less worth it. It's not so much a treat. It's more of this is something that you just cannot have. It's not good for you. Um, and she's old enough now to see that for herself. And so she chooses to make that decision on her own.
And both my girls they're at that age where they can make that decision. My one's in college and she's just like, Mom, I don't do well on tests. Like I can't study. I said, well, let's look at some ways to help you. Like, let's kind of look at maybe some good supplements, that we can take to help with your focus or your memory or, some good omega fish oils or,
Yeah, absolutely. And I love, oh my goodness, there's so many that support cognition, but L-theanine and ashwagandha, rhodiola, and SAMe is another good one. Glutathione helps support the immune system, but it also helps with detoxification. And so that can help with brain fog for a lot of people. But there's so many fantastic mushrooms that help with, we've got reishi and cordyceps and lion's mane, and all of that helps with cognition as well. So I I tend to have little organized boxes of multiple bottles of supplements that are on my bathroom counter, and they're in the kitchen, and we've got powders and pills and liquids and all kinds of things because it's, if it's there and it's easily accessible, then teenage children will tend to use it a little bit more frequently. And I have a son that's almost 18, a daughter that's almost 8, and our foster son just turned 3. But everybody is in a pretty good routine of at least 3 or 4 times a week reaching for supplements that I have sitting out that they know are good for either focus or a little bit of extra anxiety if there's a test or if there's something going on social with school and things like that. My son has used products long enough now that he knows ashwagandha will help him sleep. And if he's got a lot going on and he's a little anxious about that, I do see him use some of those products a little bit more frequently, and then it trails off again, of course. But so I actually have a couple of offerings that are newer to my practice that I'm really excited about. And so I had touched on the SoftWave machine, which is the ultrasound delivered radio frequency device that lifts and tightens the skin. It can be used anywhere on the body, and because there's no downtime, you can immediately go out in the sun, you can submerge in water, you can do all the things that like laser work and some of those other aesthetic procedures really don't afford people to be able to do. So that's really exciting. But something even newer than that is RPA, which is regenerative protein array. So think stem cell, except about 4 times removed. So there's no cellular material. There's no DNA material. This has gone through a 4-step process to remove all of that. Why would that be important? Well, for example, it's theoretically possible that if somebody had been carrying a sickle cell trait and received a stem cell therapy where there was still genetic material intact, along with DNA, that could potentially trigger the unlocking or the initiation of sickle cell anemia, not just as a carrier, but as the disease process. So there's some risk, and there's obviously a screening process, and it's not for everybody for a variety of reasons. But what RPA does is it kind of removes some of that risk, and it also removes issues that people might have surrounding that type of therapy, based on how it is procured and the process that it goes through to remove that cellular material. Ultimately, what you're left with is a protein that regenerates soft connective tissue. This can be infused as an IV push, and it can help with neurologic disorders like neuropathy, people that have had issues with long COVID, a variety of long COVID symptoms. There's so much from tachycardia to respiratory issues to it triggering chronic migraines and things like that, this is something that could be given systemically to alleviate some of those symptoms, but it can be done intra-articularly for osteoarthritis. Really quite an array of pain or disease processes, but it can also be injected as an aesthetic adjunct. It can be microneedled into the face. It can be injected like filler. It essentially stimulates collagen as a regenerative protein. And so again, we've kind of crossed pain management and chronic disease back into aesthetics. And to kind of bolster those RPA results, Push Patch is a brand name patch that infuses NAD, glutathione, BPC 157, and you can do that directly over a joint. And using the ionphoresis technology to infuse that to help bolster those results after an RPA injection, or you can use the patch alone. You can put it anywhere on the body, and it's absorbed systemically over about 12 to 14 hours. And that topical absorption is much more sustained and keeps blood levels significantly higher than injections of those products, which typically elevate blood levels for about 2 hours. This is significantly more effective over a longer period of time, and there's no needles. So the Push Patch is another great way to use peptides, glutathione, NAD, to help with regenerative processes, but also just for health in general, to boost your immune system, to keep your NAD levels up, which is very anti-aging, but also really help with, supporting connective tissue health through using like BPC 157.
Well, the NAD seems to be like this big hit. Like they are talking about crazy on social media. And I went to a tailgate, and she's like, oh, we have NAD. Like they're doing hydrotherapy. So they're doing the IVs and adding NAD. Well, NAD, we've been using it, for the last 5 years. So it's now becoming really popular with the needling, getting that through the hydration therapy. Are they getting it faster than the patches? Because it's going right into the bloodstream.
So a NAD IV or doing it sub-Q is a good way to get it in your system and bypass. We know that we lose a lot to digestion, and there's oral forms of NAD. There's precursors to NAD that are a little bit more hardy and can get through digestion, but if somebody is really struggling and they would benefit from NAD, an IV is fantastic, but it's not well tolerated. So it typically causes flushing similar to niacin, and can cause some chest and abdominal pain during that IV infusion. So it's typically given slow over quite a long period of time. And not everybody wants to sit for 6 hours and get an IV every week. So the alternative has been sub-Q injections at home, which is, quick and easy, and a way to do it a little bit more often with some consistency. But the Push Patch goes beyond that. And because it's over such a significant period of time, You're getting a lower dose each hour for many hours. And so there's none of the flushing or the abdominal pain that people feel when they get an IV. The issue with the IV too is that it's in and out very quickly. And so again, you've got about a 2-hour max where you're receiving benefit from that product and then it's gone.
Well, that's great. So you're offering that at your business and you take insurance?
So these are FDA approved products and devices, but that are not covered by insurance. People can use their HSA. I also have interest-free financing that's in-house, and so it's not a credit card and it doesn't affect their credit. But there are lots of different ways to pay, but I do not accept insurance since most of these things are not covered by insurance anyway.
That's exciting. Are you going to be running any specials anytime soon? Or
Absolutely. So we've got the holiday market coming up at the event center at Sandhills Global Event Center, the 23rd of November. I will have a booth there and people will be able to enter to win a drawing for $500 off, either an RPA infusion or a soft wave treatment. So that's pretty significant. And, we'll be doing that for the holidays and then probably something again around Valentine's Day so that people can treat themselves after the first of the year.
How many treatments would you say that someone would need to see results in that soft wave?
So it's typically a single treatment. If there's severe laxity, then usually in a consultation, which I do beforehand, I'll just let people know that that's going to be probably a 2 or 3 treatment procedure to get the results that they want. But if they maintain them, then by repeating that treatment every 1 to 2 years, the hope is that it never gets that severe again.
Well, Stefanie, thank you so much for being on today. I really appreciate it. I'm going to link your information on the website where people can get in touch with you and come see you.
Awesome. That would be great. So I'm located at approximately 16th and Old Cheney, inside the building where Blush Bridal and the Cigar Bar is. My office is inside Jorgensen Physical Therapy at 5505 South 16th Street.
Great. Well, thank you so much. And thanks so much for taking your time and being on today.
Thank you for having me.
Thank you for joining us for this episode of Go Ask a Nurse. A huge thank you to Dr. Stefanie Leyden for sharing her incredible story, her insights on advanced nursing practice, and her dedication to compassionate care. Remember, don't stop asking questions. Continue to be your own advocate on your own health journey. And please visit us on goaskanurse.com for more episodes and resources from nurses making a difference every single day. Make sure to follow us on Spotify, YouTube, Podbeam, and soon to be Apple.com. Be blessed. The information provided on this podcast is for general informational and educational purposes only. It is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition or health concern. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. The views expressed by guests on this podcast are their own and do not necessarily reflect the views of the host or Go Ask a Nurse.